Treatment for narcolepsy. Narcolepsy is a chronic condition. Even though it doesn't have a current cure, some treatments can help you manage your symptoms. Avoiding drugs, lifestyle adjustments, and malicious activities can all play a role in managing this condition. There are several medications used by doctors to treat narcolepsy, such as Number 1. Stimulant. These includes armodafinil, modafinil, and methylphenidate. They can improve your ability to stay awake. Even though the side effects are unusual, they may include nausea, headaches, or anxiety. Number 2. Serotonin norepinephrine reuptake inhibitors. For example, venlafaxine can help treat cataplexy, hallucinations, and sleep paralysis. Side effects can include digestive problems, insomnia, and weight gain. Number 3. Selective serotonin reuptake inhibitor such as fluoxetine can also help regulate sleep and improve your mood. However, side effects such as the feeling lightheadedness and general dry mouth is common. Number 4. Tricyclic antidepressants. This might include amitriptyline and nortriptyline. They can reduce cataplexy, sleep paralysis, and hallucinations. These older drugs can have unpleasant side effects, such as constipation, dryness of the mouth, and urinary retention. Number 5. Sodium oxybate. Sodium oxybate is the only medication approved by Food and Drug Administration, FDA, to prevent cataplexy and overcome excessive daytime sleepiness. However, like other drugs, there are pros and cons to be considered with your doctor. Side effects can include nausea, depression, and dehydration. Number 6. Pitolisant. Pitolisant releases histamine in the brain to reduce sleepiness during the day. FDA approved recently for the treatment of narcolepsy. Side effects may include headaches, nausea, anxiety, and insomnia. How is narcolepsy diagnosed? If you experience excessive daytime sleepiness or one common symptom of narcolepsy, talk to your doctor. Feeling sleepy during the day is common in many types of sleep disorders. Your doctor will ask about your medical history and do a physical examination. They will look for excessive daytime sleepiness history and episodes of sudden loss of muscle tone. Your doctor is likely to order a sleep study for you and several other tests to determine and confirm their diagnosis. Here are some general sleep evaluations that your doctor can order. Number 1. Polysomnogram testing, PSG testing, which requires you to spend the night in a healthcare center. The doctor will monitor you and use the electrode when you sleep to measure your brain's activities, heartbeat, and rhythms, eye movements, muscle movements, and breathing. Number 2. Your doctor will ask you for a detailed bedtime history, which might include completing the Epworth Sleepiness Scale, S. S is a simple questionnaire. It asks how much you are likely to sleep in a different state. Number 3. Your doctor may ask you to take a detailed note about your sleep pattern for about a week. This sleep note will help show your doctor correlation between your vigilance and your sleep pattern. Number 4. Actigraph or other home monitoring systems can trace how and when you fall asleep. This device is used as a watch and can be used along with a sleeping diary. Number 5. Multiple Sleep Latency Test, MSLT, determines how long you will fall asleep during the day and how fast you enter REM. This test is often given a day after PSG. You have to take 4 to 5 naps all day, every 2 hours apart. Number 6. Your doctor may use a spine tap, or a lumbar puncture, to collect a cerebrospinal fluid, CSF, to measure your hypocretin levels. Hypocretin in CSF is estimated to be low in people with type 1 narcolepsy. For this test, your doctor will put a thin needle between 2 lumbar vertebrae. However, it is not common in clinical practice to diagnose narcolepsy. Causes of narcolepsy? The real cause of narcolepsy is unknown. However, most people with type 1 narcolepsy have the low amount of brain protein called hypocretin. One of the functions of hypocretin is to regulate your sleep-wake cycle. Scientists think many factors can cause low hypocretin levels. Gene mutations have been identified to cause low hypocretin level. It is considered that this hereditary deficiency, along with the immune system that attacks healthy cells, contributes to narcolepsy. Other factors, such as stress, poison exposure, and infections, can also play a role. Some risk factors for narcolepsy can include the following. Family history. If you have family members with narcolepsy, you are 20 to 40 times more likely to have conditions. Age. People aged between 10 and 30 are likely to receive a diagnosis with narcolepsy. However, narcolepsy is usually less diagnosed or misdiagnosed. Narcolepsy complications. Complications related to narcolepsy include the following. People with narcolepsy experience often depression and anxiety, but it is not clear whether these are symptoms of narcolepsy or because of the symptoms that affect the quality of their lives. Because of excessive sleepiness and cataplexy, the way you socialize may be affected. For example, you might have difficulty staying awake during social meetings, or you might lose muscle control when laughing. Perhaps because of the level of lower activity or slower metabolism, many people with narcolepsy are often overweight. Adults with narcolepsy have a weight of around 15 to 20% more than the general population. Studies show that people with narcolepsy may have an increased risk for suicidal behavior. To avoid this complications, work with your health team to overcome symptoms or side effects of treatment that concerns you. Lifestyle recommendations. Here are some steps you can take to make living with narcolepsy easier and safer. Tell your teacher and supervisor about your condition if you fall asleep at school or work. Know that some narcolepsy treatments will cause you to test the positive for stimulant on the drug screen for work. Talk to your employer first to prevent misunderstandings. Eat lighter vegetables during the day. Don't eat heavy food before important activities. Try to take a nap 10 to 15 minutes after eating. Schedule nap throughout the day. This can help you avoid sleepiness during the day. Avoid nicotine and alcohol. They can make symptoms worse. Exercise regularly. This can help you rest better at night, make you alert during the day, and help manage your weight. Some states can limit privileges for driving to people with narcolepsy. Be sure to check with the local motor vehicle department. They can help you from harming anyone and yourself. Thanks for watching. Why not leave a comment below and let me know what you think. If you liked this video, share the love and give it a thumbs up.